Okay. So this goes into the STDs. And so the first one that we're going to talk about is syphilis. And so this is where we go into the history. The history of syphilis is interesting in the fact that we didn't quite understand all the ramifications of it until recently. And so there's a lot of historical markers that we can look back on in different leaders and different situations in the past and go, maybe they had syphilis. And the reason why we say that is it's a very ancient disease. There's actually hieroglyphics, Egyptian hieroglyphics dictating somebody that may be having syphilis. It's got multiple different stages to it. So the very serious disease in the early years, a lot of people died of this particular disease. The available treatments that they would use, and again, I implore you, if you've never gone down to it, on Royal Street, there's the pharmacy museum. You can go in there and you can actually look at all the old medicines that we used to use. And it's quite frightening. Some of them are mercury. I mean, mercury is incredibly toxic, but there was a moment in time where people believed that mercury was a cleaning agent or a healing agent. They would give people large doses of mercury, which essentially all you're doing is toxifying them. Others would be plant products. This would be what we know as homeopathic medicines. And whether you believe in them or not, there's a large cohort of people that have always believed in them, and so they've been part of the syphilis treatments in the past too. We now have even more antibiotic-resistant versions of it, so it becomes even a scarier disease than it has in the past. So it was first discovered by somebody named Fritz that observed these pale, slender, motile organisms. So it's another spirochete. And he recognized it from the syphilitic wounds of certain people. So they come in. This is somebody that has full-blown syphilis here on their back. You can see all the different wounds. Here's another one. So when they actually took a sample from one of these wounds, they could actually see the live organisms underneath the microscope. And so we know those as spirochetes. So just like Lyme disease, remember these are the corkscrew-shaped ones, that when they actually burrow in, using that corkscrew shape to burrow in, and it's very difficult to get medicine to them once they burrow into the tissue. Fritz was able to conclude that they were the causative agent of syphilis, even though he couldn't culture them in the media. So remember, Koch's postulate says that we have to be able to pull it out of the organism, grow it, give it back to another organism to prove that it's actually what causes the disease. He was able to do that without growing it on the medium. And we now know that that particular bacterium is Spirochaeta pallidum, or the pale spirochete is what that translates into. We'll cover it more probably on Tuesday when we come back, because it's kind of halfway through the slide, so I don't know if I'll get to syphilis today or not. Touch screen, but I didn't know. All right. The first ones we're going to cover, probably what we'll get through today, is going to be mostly urinary tract infections. And so this will be the different variations of UTIs that we see. UTIs are one of the most frequent healthcare-associated infections that we see. So a lot of people are going to come into the clinics with UTIs. And we're going to see that there's most of them are not going to, most of them are benign, but they do have a lot of pain associated with them. They do have secondary problems that they can cause, so it is important to get them treated. Healthcare-associated urinary infections, so one's healthcare-associated, ones that they contract while they're in the hospital or in a clinic inpatient, require testing. This is what we call, these are going to be much more serious than ones that we get from the community, where you may just get it at home and then come in and get checked on it. But they get it from childbirth. It's called pleural fever. So again, if you get a UTI after childbirth, it has a different name. We call it pleural fever there. Now, the book likes to use the word STI. Most of us in there use the word, use the acronym STI. STI is sexually transmitted infection. Most of us call them STDs. That's the common. So you'll hear me call them STDs, but in your book they call them STIs. Same difference. Infection, disease. The book, whatever, these authors just like using STI. The U.S. has the highest reported incidence of STIs among economically developed countries. Not something to be proud of, but there's some I can say that, while we do have a lot of freedoms and a lot of different ideas here in the United States about, sex compared to others around the world, one of the things that I think and it's just my personal opinion that we have the highest report is because we have better diagnostics capabilities. And we actually care enough to figure out what somebody's infected with. If somebody comes in with something that you don't really know if it's gonorrhea or chlamydia, because both of them have pretty similar manifestations, you may just be giving them an antibiotic in another country. Here, we're going to diagnose them and make sure that we know exactly what they have. So, but the book likes to point it the other way, where we're a little bit more promiscuous here in the United States. So 85% of all college and high school students have had intercourse. 1/3 of those have actually boasted that they've had more than 6 partners by the time they're done with college. Again, congratulations to them, I guess. 70% of them are going to say that they rarely used any sort of protection. So again, I'm not sure if those numbers are accurate or not. I've seen numbers all over the board on both sides of that argument. So just talking about the urinary tract, most of us are familiar with this. Again, I don't ask you much A&P, but to point out the important parts for diseases when we're actually talking about, this one's a little bit more important, look at the anatomy. Kidneys, uterus, bladder, urethra are all part of what we call the general urinary tract. The kidneys are responsible for filtering waste away from the blood. And so any sort of bacteria that comes in through sexually transmitted disease is got to make its way all the way up to the kidneys. If it makes its way all the way up to the kidneys, it's a pretty extreme chronic, you have some serious problems. Other ways that it becomes problematic is if it goes from the uterus up into the bladder, then we get bladder infections. That's more serious than a UTI. All of this is all based off of urine. So urine is going to be actually a cleansing agent. Not only are we using urine to get rid of some of the waste in our body, but that downward motion of the urine coming from the kidneys, bladder, out through the urethra is actually cleansing too, pulling out any sort of infectious agents that might be there and trying to get them out of the body. The number of mechanisms that are protecting the GTI area are going to be the sphincter muscles that help keep the urethra closed. So that way it's not open to the environment. That downward urine, as I pointed out, is going to have not only the waste that we're trying to get rid of, but it's also going to have a lot of acids in it. And again, a lot of these infectious agents can't survive the acid. Also going to have some of those antimicrobial things that we've talked about before, like the lactoferrins and the lysozymes and things that we've seen before in the mucus. One of the things that's important why women tend to get UTIs more than men is that they have a much shorter urethra, and therefore it's much easier for the infectious agent to get into the urethra and start causing damage. So longer to better actually makes sense in this case, or bigger to better.
Is there any basis in fact for women, like how women are told to wipe front, I think it's front to back? Is there any basis in fact for that?
Bacteria.
Oh,
Yeah,
okay.
for sure. For sure. There's a couple misnomers out there that are important for this too. I just was reading a story about similar to that was somebody, it was actually a gynecologist saying that, stop being shamed into believing that your vagina is dirty, because it's actually probably one of the cleanest parts of your body, because it has all these mechanisms to keep it clean naturally. And so therefore, some of these things that we believe, douching and things like this, are actually counterproductive to protecting yourself, especially people that have UTIs on a regular basis. So genital system, again, nothing surprising in here, things you've seen probably since high school. But the ideas that we're looking at are going to be, when it enters into the urethra, how close the bladder is for it to be able to move up into the bladder. And then we're going to be talking about some of these diseases as they continue to get worse. For some people, they get up into the fallopian tubes, which are right around the corner too. And the fallopian tubes, then if it gets in there, this is a very thin area. It's really just to allow the egg to move down into where it needs to go. So it's a very thin tube. And so any bacteria or any sort of disease that gets in there, it basically blocks up or clogs the system. And so people that end up getting UTIs that move into the fallopian tubes sometimes end up having the chronic condition of sterility, because essentially the egg isn't able to get past there anymore. It's scarred up. If it moves up from past there, it's going to get up into the kidneys, and then it becomes even a worse situation. Men, again, much longer urethra because it's attached to the penis, which is external. So essentially it's much longer. So therefore we don't tend to get UTIs as often. But it's certainly not out of the realm of possibility that men get UTIs too. Our problems are going to relate to then, the bladder's right around the corner, but also the prostate gland is right behind the bladder, underneath the bladder. And that ends up getting infected. It starts swelling up, and then end up having prostate problems, especially in their older age. And the more that continues to happen, it could potentially turn into prostate cancers. And so this is where it becomes a problem for men. Is where it gets in there. Also, sometimes for men, it can get into the vas deferens tube, which is where the semen is able to move from the testicles up. And just like in women, that's a very thin tube. And so if it gets infected, it can lead to sterility issues also. So this is where a lot of these UTIs, a lot of these STDs, while they may not be fatal, they also have this condition of causing sterility, which can be a good or bad thing depending on who you are. All right. Okay, so this is important just to add into what I was just saying about that story I was reading the other day. The urinary tract, especially for females, is going to just be loaded with resident microbiota, right? So we're going to be talking about how these diseases manifest sometimes because lactobacillus gets knocked out. So if you're taking an antibiotic, lactobacillus is a bacterium normal microbiota that we were talking about back in chapter 14. What it does is it produces acid. It produces lactic acid. That lactic acid drops the pH in the vagina to a much lower level than the pH of 7. That's normal. And that acts as a protective mechanism. If the lactobacillus is knocked out by an antibiotic you're taking, that causes the pH to move up to closer to 7, and that's going to allow more potential for diseases to show up and start manifesting. So sometimes we see, especially in the clinic setting, we'll see women coming in after they've had antibiotic treatment, now dealing with a UTI. And that's probably because of the normal microbiota that was knocked out. And so that's really what this is talking about here, is just explaining that is there for a natural reason. It's there to help protect against any sort of pathogen. So almost like the innate system. It really is part of the innate system. So the first one we're going to talk about here, disease-wise, is bacterial cystitis. And so this is what we call generically a bladder infection. So the easiest way to diagnose it is to have a patient, urinate in a cup. And the first thing we're going to see, you see this is actually a picture of a sample. Somebody has a bladder infection. We can see that it's very cloudy, right? Urine, while urine is normally a yellowish color, it's never that cloudy. That cloudiness is caused by basically pus, right? So the pus that from what we've noticed in an infection, we know that's all the dead neutrophils, the blood cells that have gotten in there, causing that white pus. When you mix it with urine, you're going to get this, this cloudiness to it. And so that's pretty standard for somebody that has a bladder infection to see this type of a sample. It's also going to have a bad smell if you want to open it up and smell it, which again, I don't suggest unless that's your job. What happens here is moving from the bladder. What I said, bladder is already up north of the urethra. And so by the time it's in the bladder, it's only another step away from the kidneys. And so if the bladder infection is allowed to manifest and get up into the kidneys, the disease becomes pyelonephritis, which we've already seen before. Pyelo just means inflamed, fire, essentially. So it's inflamed kidney. And when that happens, they're going to have some very serious problems. They're going to have a lot of pain, and it's back pain because that's where your kidneys are attached, right? They're attached back here near your back of your spine. And so if they have back pain down here, that's usually a telltale sign that they're having kidney problems. Tenderness to where the kidneys are, of course, because they're inflamed. But, the other manifestations are going to be fever chills, so that fever chill cycle where they're going through major trauma from the immune system. Vomiting, just because of the pain usually. It's not going to be a manifestation that causes them to vomit, but it's going to be because of the pain that's causing them to vomit. And so having repeated episodes of bladder infections. So some people are just prone to bladder infections. But having that repetition happening for their entire life and occasionally ending up as pyelonephritis. They start having scarring and shrinking of the kidneys, which then can lead to failure of the kidneys, leading to needing transplants or death, depending on the situation. Now, the bad thing part of this is that this is nothing that most people can actually prevent, because bladder infections are actually going to be caused by the normal microbiota. So this is just bad luck for most of these folks that end up getting bladder infections on a regular basis. 80% of the cases are going to be from a specific E. coli strain. So going back and looking at the 6 major pathobars of E. coli, one of them was the uropathogenic ones. Those are the ones that are causing the bladder infections. But there's also Klebsiella, Proteus, and Staphylococcus, a different version of Staphylococcus than we've seen before, but all these are part of the normal microbiota and can eventually potentially lead to bladder infections. For people that don't get them naturally, and maybe their first or only time they've ever had a bladder infection, it can come from hospitalization and people that end up having catheters for longer than they need. This used to be a problem, a decade or better ago, but now that we're understanding diseases better, we're actually getting better at understanding these catheters need changed out on a regular basis. However, there are situations, especially in nursing homes and others that may not have the best health care, that maybe they might have their catheters in for longer than necessary, or they don't get them changed on a regular basis, and that can lead to bladder infections. So this is a problem for a lot of different areas, not only just natural bladder infections, but also long-term catheter use. The pathogenesis, it moves up from the urethra to the bladder. So these normal, part of your normal microbiota, or if it is one of the pathogens, is already in the uterus or urethra and moves up into the bladder. They're going to attach, just like, there's nothing new here from anything we've looked at from skin all the way forward. They have to attach. Once they attach, that's when they start causing damage. They start killing the epithelium cells, allowing the bacteria to move to the other side of the epithelial layer. And that's going to cause the bladder infections, start causing the pus, start causing that cloudiness that we see in the urine sample. And once they get inside there, they could eventually move up into the other areas, getting into the causing sepsis and getting into the blood. But usually it's not going to happen that far. It's usually just going to stay as a bladder infection. It clears with some simple antibiotics, and the person's going to be all right. So about 1/3 of all women are going to develop some bladder infection at some point in their life. Factors that predispose women: shorter urethra, so easier to get to the bladder compared to a man. Sexual intercourse, can cause that to happen. Birth control devices. Why birth control devices? These are devices, so these are ones that are inserted. Again, inserting any sort of thing artificial, just like the catheters, could potentially allow bacteria to grow. But yet again, this is things that we've recognized over years and decades, that now the material that we're using to produce these devices are usually going to be much better at preventing bacteria from growing on them. Factors for men: enlarged prostate. Enlarged prostates slow down the speed of urine, and that could potentially allow bacteria to climb up faster into the bladder. So larger prostates can be problematic for men. Treatment and prevention: just a few days of antibiotics is usually enough. If it's pyelonephritis, where the kidneys are damaged, they're going to need to be hospitalized and use some intravenous antibiotics to try to speed up the clearance of it, now that it's actually causing damage to an organ. Drinking enough water, keeping hydrated. What's that doing? It's just increasing the amount of urine you're producing, helping push it out, flush it out of the bladder. Urinating following intercourse, any sort of bacteria that was entered into the body during intercourse can be flushed out. Again, urine has a great flushing mechanism to it. Cranberry juice, green tea, these old urban tales that can be helpful. There's no documented evidence that they actually help. There's no sound reason, biologically, medically, why cranberry and green tea may be helpful. But it's inconclusive. So that just tells us that, maybe there is something still there. But from the research that's done, there's really not much that we know about it to actually be helpful. Antibiotics are the best. All right, stepping up our game to bacterial vaginosis. So here we're looking at just female, right? That's the name. And this one's got going to start getting a little bit into the grosser stuff with the STD. So here we're going to have a thin, grayish white, bubbly discharge. So the bubbly discharge is coming from the metabolism of the bacteria producing gases, just like we see in gas gangrene, producing these gases. And these gases are also going to have a strong smell to them. And so it's known to have like a seafood or a bad fish smell to it. And this is due to just the metabolism of the particular bacteria that's causing the disease. This bacteria can spread from the uterus up into the fallopian tubes, and this is then what we call pelvic inflammatory disease. So when it has pelvic inflammatory disease, that means that the bacterial infection has moved up from the urethra up from the uterus up into the fallopian tube, and this is where we worry about sterility issues for that woman. Luckily, about half of the cases are asymptomatic. So most people aren't even going to know that they have it. They're not going to have any of these issues. Usually their body's able to put it right back into play. Causative agent. Don't know because it could be any mixture of different bacteria. Again, the normal microbiota gets out of place. Usually going to be caused by that lactobacillus not producing the acid like it should. So any sort of bacteria that's there that shouldn't be could potentially lead to vaginosis. So the discharge is going to contain all kinds of different bacteria. That's why we don't know which ones it is, because when we test, we send it down to the pathology labs and have it looked at to see what's actually there. It comes back with a litany of different bacteria. So nothing we can just point at and say, aha, it's caused by this one and only agent. But it's pretty easy to diagnose. Besides the discharge, we can actually diagnose it by what's called clue cells. Clue cells are going to be epithelial cells that have been sloughed off of the vaginal wall and are covered with bacteria. And so here we can actually see this cell right here. We can see the nucleus and all these little blue teeny tiny dots all over it. Those are bacteria. And so a trained pathologist would get a sample brought down to the lab, look at it underneath a slide, and see those blue cells and say this is bacterial vaginosis, just basically backing up what the docs probably already knew. But this is one of those things that is helpful for diagnostic purposes. Usually there's no inflammation unless they have another infection going on at the same time. So remember, one of the ways that lactobacillus can get knocked off its game is when you're taking an antibiotic. You probably take an antibiotic because you have another infection, right? And then the antibiotic causes lactobacillus to be knocked out, causing vaginosis to show up. So normally there's going to be no inflammation in the vaginal area unless you're having a secondary infection at the same time. As I said, that odor that is defined as being a fish-like odor is caused by the metabolism of those anaerobic bacteria. So epidemiology, not well understood because there's so many different causative agents. So epidemiology, how do we trace back how you contracted it or what happened? There's just so many different causative agents. There's no way to do that. However, it is the most common among all sexually active women. So we do see this on a regular basis. So if you're going to work in a clinic or work in an ER or work in an urgent care, you're probably going to see this on a regular basis. Unfortunately, sometimes in sexually abused children, we see it. These are special cases. If you end up working in a pediatrics firm and you see something like this, you're going to know that the child's probably been abused. So again, telltale signs of being able to help the child out. Not only do they have a disease, but you can back up and say, well, it's probably from abuse. And therefore, usually if a child comes in with this, it's a reportable disease. It needs to be reported up the ladder to authorities. Pregnant women can have increased risk only because anything that's that close to the placenta can potentially cause damage to the child, causing damage to, though the fear is always a miscarriage or spontaneous abortion. Anybody, anything that's going to put you at higher risk, multiple partners, you're going to see that the epidemiology and prevention measures are always the same: safe sex, minimizing partners, all the boring stuff. But ultimately, women with multiple partners or use of IUD are going to be at increased risk, but no proof of sexual transmission It's just things that cause damage to the vaginal wall, damage to the normal microbiota could potentially allow this to happen. So it's not that the man's giving it to the female. It's actually just, happenstance that occurs. With treatment and prevention, most cases are going to respond quickly to antibiotics, so not much happening there. Disease can recur because there's no immunity, right? Because there's so many different causative agents. There's no way that the immune system can build immunity, so there's no real protection there. Prevention by abstinence, as I pointed out, starts getting redundant in the prevention mechanisms. Abstinence, limiting of partners, avoiding any sort of cleansing, like I was just pointing out earlier. Treatment of male sex partners does not prevent recurrences, right? This is just a female-only disease, but treating the partner is not going to stop the disease from happening. All right. Whoops, wrong way. We'll do the last one here, and then we'll call it a day. This is vulvovaginal candidiasis. So this is yeast infections. So this is just what we normally would call yeast infection, but the proper medical term there is vulvovaginal candidiasis. Constant and itching and burning, right? This is only going to be females too. So itching and burning sensations, this is usually going to lead you to try to seek treatment, whether it be OTC or running to the doc. This one's going to have a different type of discharge. It's not going to have the smell associated with it as the bacterial one because the yeast causing it. So it's a different species, different metabolism, so you don't get the same signature signs and symptoms as you do with bacterial. So it's pretty easy if you work in a women's clinic, as a doc or as a nurse, to be able to see the difference between a bacterial infection and yeast infection. The biggest thing there is a bacterial infection treat with antibiotics. The yeast infection you got to treat with other medicines, right? Because yeast are eukaryotes, so that's the biggest thing here. Usually going to have some inflammation, so it's going to be red and swollen on the interior, and what we call these like clumps of what they call cottage cheese looking clumps of discharge that's happening. And again, definitions that help us differentiate between the bacterial and the yeast infections. So the causative agent is one of our normal microbiota, right? Candida albicans. So this is just one of our normal microbiota yeast. Yet again, when it gets out of its lane, I guess is the best way to say it. The yeast starts growing more than the rest that it should. It starts leading to some of these manifestation signs and symptoms. So pathogenesis, not a lot of symptoms usually for somebody. Most people are going to be asymptomatic, but that's going to be because the growth is usually limited by the immune system because it is part of the normal microbiota. So just being redundant, what I've already said, it's up there on the board there. Anything that disrupts that balance, so it can lead to a yeast infection. So anything like menstruation, because hormones are changing, pregnancy hormones are changing, oral contraceptives, hormones yet again, antibiotics, well, you're just wiping out the normal microbiota. So any of these can lead to changes in what's considered normal for the microbiota, can lead to Candida albicans growing out of control. Never guarantee it's just going to be Candida, but when Candida albicans does grow, you end up with usually yeast infections. Epidemiology, late pregnancy, just because there's not as much room, and therefore you potentially can knock out the microbiota. Poorly controlled diabetes, not as much blood flow, so the immune system's not able to get keep control as well because a lot of the immune system is your leukocytes, your white blood cells. So people that have poorly controlled diabetes usually have slower blood flow than others. Use of oral contraceptives, again, throwing off hormones, antibiotics, throwing off normal microbiota. Hormone replacement therapies for people post-menstrual. What is it? Is that what it is? What is it called? Menopause, right? Post-menopause. Essentially people that, are post-menopause, women post-menopause that tend to get, some of them get hormone replacement therapies that help with some of their signs and symptoms. Yet again, you're messing with hormones, right? So you can move them off. However, most people don't have any predisposing factors. It just happens because it is such a cluster when it comes to normal microbiota. Does not spread person to person, but the biggest thing here is to know we can't use antibiotics when somebody has a yeast infection. We have to switch it up and use antifungals to ensure that we're treating it with the right medicines. Over-the-counters are usually going to lead to drug resistance. They're not very helpful because most of the antifungal over-the-counters are not successful for interior use. They're mainly external. All right, so we'll stop there. Probably grossed you out enough for the weekend. Usually always makes me a little queasy telling